Hey, 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 Coach Kinsey Shae here for Heart Space. And I just wanted to talk about care and overcare. When our care starts to become depleting, because care is love in action. But if we have the wrong intentionality behind it, or if we take away another person's ability to be able to do something or willing to do something, the care can be overcare. We get in this cycle of depleting our energy because we hold true what we think in our mind is best for them. We can do this with our children. We can do this with our patients as a nurse. We can do this in the military with people below us or that we work with. It can be any form of care, but our intentionality of the care is what matters, because we can get in this depleting cycle where it turns to worry, guilt, fear. A good example of this was when after my car accident. Many people, they just wanted to do things for me. They wanted that masculine energy of fixing it, but it did not serve me. Somebody, pushing my wheelchair, yes, it was a form of care. But what was going to be there when they weren't there? I would have to do it. So it can get the other person in a cycle of relying or almost a victim type of mentality that I can't do anything for myself. The most precious moments were when people, when I was trying to use my left arm. I had a friend ask me, "Do you want to cook?" And I go, "Yeah." So they got the food for me and we made a night out of it. And I cooked a meal. Yes, it took me probably 10 times longer than what it does now. But it allowed me to have the ability to do it and the will to do it. That person just didn't do that for me. So when does care turn into overcare? When we identify ourselves for the reason why we're doing the care. Meaning if we can see ourselves in that person and we already map out in our head how it's supposed to go. In this instance, you're taking away their ability and their will to propel forward. And when we already have this mapped up in our head, what other people should do, we worry. We anchor to all of those lower vibrational type of worry, fear, all of that. It takes away from the love, that vibration. Another thing about love and care is when you do something expecting something in return, it's not care. It's over care. We're doing something to feel worthy. When I first got into nursing, I liked nursing for the fact that I would do something and I would get recognition. Over time, I realized that it took away, because I already mapped out in my head how the patient was supposed to progress. I already mapped out on this, that, and the other. But I took away their will and their ability. And I anchored to those depleting energies, because when I went home, I worried if they were going to do okay. I was fearful that they would take a turn for the worst. So over time, I had depleting energy, which led to burnout. So care and overcare are two different things. It's your intention behind it. If you are doing something out of your heart that allows somebody to have will and an ability to move forward in their journey, how they are supposed to move forward, that is care. But if once we assign and we identify with how they are supposed to show up, that's overcare, because that turns into depleting emotions. And I'm not saying that it's easy. It's easy when we have a loved one that we want to take care of, and we just want them to do this one thing because we know that it will work. But it's not our journey, it's theirs. So when you feel these emotions of, I identify with what they're doing and I know what's best, I invite you to do some heart math techniques. One is quick coherence. It's the 3 hearts, where you focus on your chest, your heart space, and then you focus in your breathing in and out through your heart. And then focus on the gratitude and breathe that energy in and out. Another one is heart soaking, where we take a situation that is causing worry, angst, and we allow that, we acknowledge it, and we do the quick coherence, and we enfold it in our mind's eye, all of the emotions, the stresses, the feelings, into a piece of paper, and let it absorb with all the compassion of your heart. And just breathe that in. But heart cutting is taking it a little bit further. Step 1, be aware of how you feel about the issue. 2, center yourself by breathing in and out of your heart space area. Breathe love and appreciation through the area for about 30 seconds or so. 3, assume objectivity. Don't anchor or identify, just observe, reflect, and reserve judgment about the feeling or issue at hand, as if it was somebody else's issue or problem. Rest. The next is 4, rest in that state of objectivity. Let me repeat that. Objectivity. Neutrality. In your rational, mature heart. Just let everything go in and out of your heart and stay neutral and objective. Step 5, soak and relax any disturbed or perplexing feelings in the compassion of your heart. Dissolve all of the significance of the issue. Absorb all the energy that's not serving you. Remember, it's not the problem that causes energy drain as much as it's stored significance you have assigned to it. So you're anchoring yourself to that energy of worry, doubt. This is absolving you of it in observance. After dissolving, this is step 6, as much significance as you can, ask yourself from your deep heart for appropriate guidance or insight. If you don't get an answer, find something to appreciate for a while and let it soak a little bit longer. Repeat these steps as needed. You see, we have a decision whether we anchor to care or overcare. And overcare will deplete you over time. You will burn out. There are some issues and situations that we can't fix, meaning bringing all the masculine energy, because when we go in and fix, we take away the other person's ability and will to go forward in their journey. So I just wanted to pop on and kind of talk about care and overcare in this month of February. There are tons of issues that, it takes time and practice to work through. But once we sit in our objectivity and give it to the compassion of our heart, we can move forward and truly care from our heart space. My name is Coach Kinsey Shae. I'm a transformational coach and a HEARTMATH trauma sensitive practitioner, a guide to your truth, your essence, to self-discovery. My friends, I love you and many blessings today. And I look forward to having a dialogue and helping you in your journey of life. Light, love, and gratitude. Take care. See you next week.